the use of the symptom survey. You see now that we've covered the high priority groups, which is digestion, the liver, biliary, and sugar handling system, as the main areas of treatment for the symptom survey. And now we're moving into some of the ancillary portions of the symptom survey, where we start to put on a little bit more of that. The frame is woven, and now we're starting to do those little outer layers that catch more bugs. So the thing to remember is it's really the habits of the patient that cause that cascade of ill health, as it is those habits that support good health. So I like to start my presentations with a quote, and I think this one is useful because it says, "The heart of a fool is in his mouth, but the mouth of a wise man is in his heart." Of course, that's Benjamin Franklin, and that's how I approach my patients, particularly when I'm talking to them about nutrition. It's important that I speak from my heart with regards to trying to encourage them to change their lifestyle, to eat a more appropriate diet, one that has fewer and fewer processed foods and carbohydrates. I need to encourage them to exercise, and I need to encourage them to reduce and manage stress. So the areas of concern that we're going to be talking about today is the cardiovascular group, which is group 4, and the foundational group, which is group 8. And as you see the symptom survey here, you'll see that's right here at cardiovascular group 4, and here the foundational issues in group 8. Now we've already spoken about liver and digestion and sugar handling. So we're going to call these non-vital areas the areas of concern. So our first few are B and G, and that's what our topic is going to be mostly about today. So this is a common theme for both this foundational group and the cardiovascular group in the symptom survey. And that question is, at its basis, 2B or 2G. So some of you may be unfamiliar with the concept of the whole B complex. So one of the things that makes standard process unique is it puts its nutrients in a whole food base, and therefore you get the entire complement or complex of vitamins when you consume that product. So one of the things that Dr. Lee recognized was that there was a separation or a dichotomy between some of the B vitamins, and those were termed the B vitamins and the G vitamins. So let's look into that a little further. First off, let's remember that all the B vitamins are generally built around creating ATP. They're working as coenzymes in the production of energy, or ATP, which I often refer to as cash. So when we consume food, we obviously have to take that to the bank and turn it into usable fuel or money, and in this case we call that ATP. So this is a review from blood sugar, but remember, we go through glycolysis and we end up with pyruvate, and pyruvate needs to be put into the Krebs cycle, and the responsibility of doing that is a coenzyme called TPP, also known as thiamine, which is what we currently call B1. And we have NAD and FAD, which become reduced and turn into NADH and FADH, and those go through the electron transport chain, which is where we create ATP. And it is that NADH, we now know as the coenzyme niacin, and FADH is flavine, or the B vitamin riboflavin. Now, one of the things that also happens in the absence of oxygen is pyruvate will turn into lactic acid, that acid that some people would say makes your muscles sore, or creates a slight acidotic state and can create some soreness or some difficulty. And in a light acidotic state, you may need more oxygen and want to breathe off more CO2, which is one of the byproducts of this process. So if you don't have oxygen available and your pyruvate does turn into lactic acid, we can convert that back to pyruvate with another B vitamin, and that's B6. So if we look back at what Roy Lee had to say about it, he said that the B complex performs an important role by catalyzing the various chain reactions through its coenzymes, FAD, NAD, what we just talked about. And this is to a very large extent related to the carbohydrate metabolism, and as such we must consider not only the amount of vitamin B complex which is provided by the diet, but also the requirement for that vitamin, which may be created by the ingestion of too much carbohydrate, particularly refined sugars. So in this paragraph that I've highlighted, I think we could replace vitamin B complex with vitamin G complex. I think oftentimes when we talk about the B complex, I think you can include G as part of that process or that whole group. So it goes on further to say that by this reason, it may prove futile to administer cataplex B without a corresponding reduction in the overall alimentation or eating of that's causing the initial problem. However, when both cataplex B, or in some cases G, is given and the carbohydrate intake is brought into range, results are usually satisfactory. So now let's start to look at this separation, what separates B and G. So let's start by looking at what we'll call the B vitamins. So the B vitamins that are found in cataplex B are predominantly thiamine, a vitamin called B4, B12, and pantothenic acid, which we'll label B5. So the thing about cataplex B is these are the vitamins that tend to be more heat stable and they dissolve in alcohol. Now, remember, all B vitamins, all of them are water soluble. They all dissolve in water. That's why when you give a synthetic crystalline version of a B vitamin, it often ends up in the toilet with very yellow urine. So it's obviously very easy to excrete in the urine because it is water soluble. Now, by separating those alcohol solubles from the non-alcohol solubles, which we'll find out is the cataplex G or the G portion of the B complex, we get a unique physiologic function. So the B vitamins tend to have an activity of constricting blood vessels or causing vasoconstriction. And they also tend to create a nerve stimulatory effect. So the vitamin B1, thiamine, which is the first B vitamin that we discovered, we learned that its deficiency created a disease, and that disease was called beriberi. And beriberi is, I believe, a Swahili term, which simply means I can't, I can't. So when I'm thinking about a person with beriberi, I'm thinking about a person who's very weak, very fatigued, difficulty catching their breath, can hardly do anything, and then just miserable for they have no fuel, no energy, no cash. If you ask them to do the simplest thing, they may answer, I can't. I just can't. So keeping that in mind, signs of B vitamin deficiencies tend to be things like a slow heart rate, irregular heartbeats, or anything where nerve transmission problems, bundle branch blocks and heart blocks and split sounds, are all related to that side of the B complex, which is stimulatory or tonic. We also see some psychotic tendencies, particularly apprehension and sort of a decrease in tolerance to noise. It also helps with digestive function and particularly with regards to creating hydrochloric acid and encouraging pancreatic secretions. The other important area that we see B vitamin deficiencies is in the neurological function. This is probably its most profound area, and why the cardiovascular problems are there is because we're losing nerve conductivity. As a chiropractor, I have particular interest in that because that's my job, that's my wheelhouse, that's where I do my work is with the neurological system. So a B vitamin deficient patient may be losing vibration sense. They may be losing proprioceptive sense. They may be getting headaches around their head that feel like a tight band. They may see an increase in lactic acid. Why? They don't have the oxygen necessary. And if they don't have the B vitamins to run that Krebs cycle, eventually that pyruvate will convert into lactic acid. They tend to have tenderness in the soles of their feet and in their calves, and they tend to wake up more often at night to urinate. They wake up and they can't get back to sleep. They get back pain and carpal tunnel type symptoms. So again, a lot of neurological pain stuff. Virtually all the B vitamins, not only cataplex B, but cataplex G as well, we're going to see some skin aberrations a little bit more with the G, but also with cataplex B, we tend to see predominantly itching or simple dermatitis. And again, if you're increasing that lactic acid load in the body's more prone to wanting to blow off CO2. So if the body's needing more oxygen and becoming more acidotic as a result of an increase in lactic acid and CO2, you're going to see a patient that can't hold their breath as long. So somebody that's short of breath has a more rapid respiratory rate. People that yawn more are often working to improve their oxygen capacity and get rid of that excess CO2 as a result of a lactic acid buildup. So where did we get this information? We got this information on Cataplex B, or at least I got this information from the product bulletin. So the product bulletin, of course, is a book that basically goes through each of the supplements that was created by Standard Process and Royal Lee, and it gives you some insight as to how that product works. So what I've done is I've copied the product bulletin, and then I've highlighted sort of in this yellow and later in sort of a blue-green some of the text that I think is pertinent to the information that we're talking about today. So when you look at the symptoms that are presented in the product bulletin, they're very similar to what we just talked about. So heart enlargement, lactic acid excess, neurological symptoms. And the reminder that the ingestion of high carbohydrate foods is often the most significant finding. So you'll notice today we're going to sound a lot like a broken record because we're going to be saying a lot of the same things over and over again. So when we move to Cataplex G, we're looking at niacin, riboflavin, folic acid, PABA, choline, inositol, and betaine hydrochloride. So these are the B vitamins that are alcohol insoluble, so they dissolve in alcohol. They're more sensitive to heat, so heating or cooking with these is going to be more problematic. The refining and processing of foods is also going to be more deleterious to these components of the B vitamins. Now, the reason that we kind of separate, instead of giving them all as a bomb, if we isolate out the niacin and riboflavin and give those foods or that whole food substance that tends to accentuate those, we get a benefit on the other side where we start to see blood vessels becoming more relaxed or vasodilating, and nerves becoming more relaxed, or the system as a whole becoming more relaxed. And as a result, that tends towards lowering blood pressure. So when we look at the signs of a G deficiency, we're looking at somebody who's a little wound up, a little bit more, you may say sympathetic. So they tend to have a fast heart rate. They may have extra beats in their ventricles. They may be suffering from a heart cramp or heart spasm, like what we call angina. Psychologically, they tend to worry a little bit more, have a little bit more apprehension, a little bit more moodiness and depression. So when we talk about niacin, the deficiency disease that we're talking about there is pellagra. And you can remember from school, the idea behind pellagra was the 4 Ds. It was diarrhea, dermatitis, dementia, and finally death. So that's one thing to consider, not only from just the signs and symptoms given here, but also when you're thinking about your patient, particularly when we see skin conditions. So obviously, a lack of the G vitamins can help you suffer some stomach acid production deficits, which is one of the reasons why I think betaine hydrochloride was put in the product to help support that in that process of improving the overall health. Because remember, the very first thing we talked about was digestive function. So it's assumed that we have already corrected that digestive function fault by the time we start working with the foundational issues or with the cardiovascular issues on the symptom survey. So again, where do we get this information on Cataplex G? We're getting it from the product bulletin. And so you'll hopefully start to notice a trend that when it concerns the B vitamin fraction, I'm using kind of a gold color, and when it concerns the G vitamin fraction, I'm using sort of a highlighted blue color. So you'll notice for the symptoms of Cataplex G, we see paresthesias, we see redness, We see paralysis. We see ascites or a venous congestion, particularly ones that are visible on the chest or the abdomen. Hemorrhoids would be another great example of too much fluid buildup in the system because the vasculature has lost its tone. Often we see eye symptoms and some mental symptoms like melancholy or loss of appetite, kind of that nervous loss of appetite. So further, if we look at the product bulletin, we see that cataplex G tends to act not so much on the nerve itself, but on the synapse. So that connection between the nerve and the muscle, or the myoneural junction, is affected by either a deficiency of those enzymes, the G vitamins, or a deficiency in potassium. It is apt to be delayed or not occurred at all, so this can result in things like paralysis or dystrophy or ptosis. So when we see some of the symptoms coming up as presented in the foundational system, you see where we get these from. So obviously you can see it's beneficial in the digestive process. So that brings us to group 8 in the symptom survey. And group 8 hasn't always been in the symptom survey. This is a new addition to the symptom survey, and I'm just going to take a guess in the last 10 or so years. So you'll often see symptom surveys that do not even include this group, and you'll notice very quickly that it was likely added um, with this concept of 2B or 2G in mind. So as we look at questions 173 through 183, you'll notice that afterwards I've sort of notated them in gold, which suggests that it's a B vitamin problem or a cataplex B problem. And you'll also notice that some of these have numbers after them because these are ones that are also found elsewhere in the symptom survey. So there are a lot of questions in the symptom survey that are duplicated elsewhere. And it's important to kind of understand that to see if the patient is being consistent in their answering, but also to help you make decisions later down the line when we get into something like the cardiovascular system, which we'll talk about later today, or when we get into the sympathetic parasympathetic balance. So there's a couple of areas that are questioned because in general you can see that this first half of group 8 tends to be associated with cataplex B, while the second half of the section tends to be more related to cataplex G. But you'll notice there's a couple here in group 8, number 178, hyperirritable, and melancholy or feelings of sadness, which tend to be a little bit more G related. And as well, numbness here, 187, is also repeated in the symptom survey as number 56. Tends to be a little bit more of a B vitamin problem. So if you're just taking a quick perusal of the symptom survey, you can make a generalization that if they're answering questions more on the upper half, that's a cataplex B problem. And if they're answering questions more on the lower half, that's a cataplex G problem. So you can see all the ones that just have B's or G's by their name. These are unique new questions to the symptom survey, and they virtually all came from the product bulletin, from the symptom setups in the product bulletin. Now, the B and G decision making is a fairly complex one, and it's not necessarily easy to remember all the time. And my mentor and our representative, Joseph Antel, has put together a really great kind of explanation of the B vitamin complex. So I've included it here in the presentation, not because I want to go over it, but just so people can see what it looks like, how nice and professional it is. And I would say it's probably more for doctor use than patient use, but a great place to read through and get a great understanding of the differences between the B and G components of the B complex. So on my web page, which is how most of you likely got to the presentation, I've included a link that will have a PDF of that that handout or whatever you want to call it, so that you can read that at your leisure. But again, it's basically the same information that you're getting from sources like the product bulletins or the clinical reference guide. So now I'd like to move a little bit more into the cardiovascular component of the symptom survey, and I want to start with just a little quick review of the anatomy. So, of course, the heart has 4 chambers, and it has sort of a right side and a left side. And we know that arteries carry blood away from the heart and veins carry blood toward the heart. So the right side of the heart is concerned with receiving nutrient-rich but oxygen-poor blood and sending it off to the lungs so that it can be oxygenated. And of course, the left side of the heart is responsible for receiving that newly oxygenated blood and sending it out through the aorta to the tissues and the rest of the body. So remember, one of the tools at our disposal that's not difficult is a stethoscope. And by listening to the heart, we can get an idea of how those areas of the heart are functioning. The other thing that we need to understand is that the heart is a very electrical system, and that the concerted effort, or the concert of effort of the heart muscle, is to be as efficient at pumping and squeezing and eliminating and improving the flow of blood through the body. And that electrical component is kind of unique in that it's going to require a certain amount of fuel to run that system. And the B vitamins, or the B component of the B complex, is the ones that tend to snap back to life the strength or the integrity of the heart, so that the person whose heart is failing, that has congestive heart failure, that may be saying, I can't, this is where we snap it back to life, is in the nerve components of the heart. So any look at the cardiovascular system should also pay attention to the difference between an artery and a vein. Of course, they both have an endothelium that lines the vessels, and then an elastin layer, and then a muscle layer. And you'll notice that arteries have a substantially larger muscle layer than veins. And that's one of the reasons why we can control our blood pressure in the periphery, is by dilating or or constricting that muscular tissue, thereby increasing the pressure. We have the tunica externa, which is connective tissue, and anytime I'm hearing connective tissue, I'm thinking collagen formation and I'm thinking vitamin C. So another thing that's important to understand in the cardiovascular system is some simple concepts that we may have forgotten in school, that the systolic blood pressure is the pressure in the system when the heart is at full contraction. So when the pressure in the system is at its greatest and the ventricles are contracting, that's called systole, or systolic pressure. And so in this case, 140 is the systolic pressure. Now, when the heart relaxes and the ventricles fill with blood, that full relaxation state where the pressure is the least is called the diastole, or the diastolic pressure. So when we're taking our blood pressure readings, we're taking the systolic pressure over the diastolic pressure, or the heart's pressure at its highest and the venous pressure, or the heart's pressure, at its lowest. So I think most people know that a blood pressure of a systolic pressure under 90 or a diastolic pressure under 60 is considered low blood pressure and could be a problem. And well, there's some argument currently on what hypertension is, but as a general rule, when I see patients with a blood pressure, a systolic reading over 140 or a diastolic over 100, then I know that that heart is working too hard. In doing that, you're going to put more stress and strain on your vasculature, and that's going to be a problem. So a few things that some of you may not be aware of is some other measurements that we look at with the heart that has to do with how well the blood is actually being pumped. So we have a couple of different what we call volumes, or amounts of blood. So when the heart is relaxed, or it's in diastole, we have a certain amount of volume in that ventricle, and that volume in the ventricle is called the end diastolic volume. And when the heart contracts and it pushes the blood out, there's still some remaining volume in that ventricle. That remaining volume is called the end systolic volume. So if you subtract the diastolic volume from the systolic volume, you'll get a number. That number is called your stroke volume. So for instance, this may, before the contraction, have like, say 120 milliliters, and after contracting, it may have 50 milliliters. And so we would say that our stroke volume is 70 milliliters. So the stroke volume is the volume of blood pumped from one ventricle of the heart with each beat. Now that's independent. You can have a left-sided or a left ventricle stroke volume and a right ventricle stroke volume. Another reading that we sometimes hear about is called the cardiac output, which is the volume of blood being pumped by the heart or by a particular ventricle, left or right, in a 1 minute's time. So on average for men, that's about 5.6 liters, and for women, it's about 4.9. Now, a newer unit of measurement called the ejection fraction uh, is kind of taking the place of cardiac output and stroke volume, because it's telling us how efficiently the heart is beating. So basically what this is saying is if we take the stroke volume and we divide it by the end diastolic volume, it'll give us a percentage. So in that example, if we had a 150-pound man and their stroke volume is 70, that was 120 minus 50, and then we divide it by the total volume that was in that to start with, we're seeing that that ventricle is pumping at about 58% efficiency. So normal for healthy people is about 50 to 65%. So things that we can do to improve the ejection fraction, or what I would call the efficiency of the heart, is going to be beneficial. And where do we do that? Well, we do that in the B complex vitamins. So it's important to remember that the heart is only doing what it's told, and it's being told to do by the nervous system. So it's getting input, sympathetic input from the sympathetic chain ganglion in the thoracic spine. And when the heart gets that sympathetic input, it does things like increases your heart rate, increases that stroke volume, the vasculature starts to constrict, and the pressure and the resistance starts to increase. So we see, obviously, increased blood pressure. Whereas the parasympathetic side is going to do the opposite. It's going to get that vagus nerve supply. It's going to decrease the heart rate and decrease the stroke volume, create a vasodilatory effect, and decrease the resistance in the system. This is normal physiology, but you'll see that by separating the B and G vitamins, we can create a situation where we can help a person who is sympathetic dominant by giving them G, and we can help a person who may be parasympathetic dominant by giving B. But that's a spoiler alert for next time, but still important for today. So some other nutrients to consider when we're dealing with the cardiovascular system is cataplex C and cardiotrophin. So we're going to take these and talk about them. In general terms, cataplex C from a cardiovascular standpoint is there to improve oxygen delivery to the tissues and to improve connective tissue integrity, to improve collagen formation. Cardiotrophin, on the other hand, is there to remove those barriers to healing of that cardiac tissue. So let's take a quick moment and see what the product bulletin has to say about cataplex C. So there's a lot to talk about cataplex C, but the primary thing that we're seeing here highlighted in the blue is the increase in oxygen carrying capacity of the blood when vitamin C is supplied in deficiency states is evidence of this hypothesis that, in addition to the natural C complex, contains the enzymes tyrosinase, which is a copper-containing factor, copper being active in the formation of hemoglobin, and obviously hemoglobin being important in the carrying of oxygen. So when I think about cataplex C, I think of that being a little taxi. That's the guy that improves the delivery of oxygen to the tissues. Now, if we go further into the clinical reference guide and we look at what it has to say about vitamin C, particularly the vitamin C complex, it goes on to say basically, the real vitamin C complex contains the vitamin P factors, which are the bioflavonoids and rutin, which maintain vascular integrity. These are deficient in people who bruise easily or have pink toothbrush. Their blood vessels break or rupture too easily and bleed. A little further on it says another factor in the C complex is vitamin J. The J factor is part of the C complex, which increases the oxygen carrying capacity of the blood. So it gives you a more efficient taxi. If you have a cold, you want to get oxygen to your tissues where it oxidizes the toxins and carries them off with carbon dioxide. So important reasons why Cataplex C is very cardio friendly. Now if we move to cardiotrophin, we'll see it plays an important role in relation to carbohydrate metabolism via the ATP mechanism. So exactly what we talked about at the top of the presentation with the B vitamins controlling the Krebs cycle and glycolysis and oxidative phosphorylation. We're improving ATP production as well as removing those barriers of healing, which is how I think of all of the protomorphogens. So any product that ends with PMG is a protomorphogen of that tissue. So in this case, cardiotrophin is a protomorphogen of heart tissue, which tells me right away it's going to remove any barriers to healing. Does it heal the tissue itself? No, but it allows that nutrition to be delivered to the cell, things like vitamin C or vitamin B or vitamin G. So we see further in the product bulletin that cardiotrophin acts as a potentiator of nutrition to the muscle cells. So the next vitamin complex we want to look at is the E complex. And E has a specific fraction within its complex called E2, similar to B and G dichotomy, as well as the C complex, which had the J factor and the P factor that we talked about. So you see, in general, Cataplex G promotes tissue repair, increases cellular activity, increases a tissue's response to stress, and acts a bit as a nerve relaxant, whereas Cataplex E2 is a specific fraction of vitamin E that promotes cardiac tissue perfusion and improves transmission at the myoneural junction. So is there E2 in Cataplex E? Yes. Is there some vitamin E, Cataplex E and E2? Yes. This is just a little bit more potent with regards to that specific fraction. And the same can be said of B and G and the different C vitamins that are available through standard process as well, like Cataplex ACP or collagen C or any of the other C vitamins. So if we look at the product bulletin in regards to Cataplex E, you'll see it helps with connective tissue disorders, neurological involvement, particularly hyperirritability. It's doing that by promoting tissue repair, increasing tissue response to stress. It's acting as a tissue repair helper. So again, all these things are telling us kind of repeatedly that Cataplex E is a tonic product or a building product. Again, if we go to the clinical reference guide, there's quite a large write-up on the E vitamin, on Cataplex E, where it's predominantly about its cardiovascular help and its connective tissue, but mostly, and I didn't even type it all here, it basically goes in to say, listen, when we're giving an isolated fraction of a vitamin, it's very similar to what does Dr. Lee say? Using high potency vitamins is like whipping a tired horse. He would be stimulated to run faster, but sooner or later he would collapse because you never fed him. So by using these synthetics, we're whipping. But if we give the whole complex in its whole food base, we're going to get those factors that are going to be nourishing to the tissues and helpful to the patient. Now, when the patient goes to the health food store, they're going to be looking for units of vitamin E. They're going to be looking for milligrams of vitamin C, and they're going to look at something like a Cataplex C and see the difference. This is where, as clinicians, we have to be able to educate them about these things that they don't see on the label, like the J fraction that helps the oxygen carrying capacity, or in this case, the E2 fraction, which helps to oxygenate heart tissue and improve cases, particularly of angina. So if we move to the Cataplex E2 portion of the product bulletin, you'll see, of course, that it talks about its ability to help angina or indigestion, hypertension, and cardiac neurosis where the heart's overreacting as a result of nervousness or anxiety. And basically all that comes down to its marriage with the vitamin G complex. So the effect of E2 and vitamin G and organic minerals in promoting that myoneural junction, uh, perhaps by participating in the integrity of oxidative mechanisms. And that oxidative mechanism uh, is one that we talked about in oxidative phosphorylation, is that end step in creating ATP or energy. If we go to the clinical reference guide and again look at E2, or that specific E fraction, you'll see that this is a food factor that will stop a heart cramp or heart pain, usually within about 10 minutes. Dr. Robert Peschick writes of E2, its antispasmodic action acts on angina pectoris much like nitroglycerin tablets. The patient can keep the nitroglycerin because E2 is preventative, precluding its need. So for those of you that may not be familiar, people with chronic angina or painful angina are prescribed nitroglycerin as an emergency vasodilator, as something to relax the blood vessels of the heart so we can stop that heart cramp and perfuse the tissue with more oxygen. But by giving that patient something that does that for them, like the E2 fraction of the E complex, we can create a situation where they don't need to take that nitroglycerin. They can keep it in their pocket, but they probably won't be needing it because we'll be taking care of the problem that's at hand, and that's the malnourishment of that patient. So that leads us to the symptom survey for the cardiovascular group. And that leads us, we'll get into the questions in a moment, but basically the cardiovascular group is broken down into two areas, either a product called Cardio Plus or a product called Vascular. And you can see that the products are remarkably similar in that they both contain vitamin C and they both contain cardiotrophin. So they're going to help with integrity of vasculature, and they're going to remove any barriers to healing to muscle tissue or heart tissue. The difference being Vasculin has the B component and the E component. E being the kind of tissue promoting healing component, the B vitamin being the energy releasing I can't helping component. Whereas Cardio Plus tends to be the relaxing vasodilatory effect. So it's not uncommon to hear people or hear it talked about give Cardio Plus for the hypertensive patient or the high blood pressure patient, and give Vasculin for the low blood pressure patient. Now this is where the cardiovascular system, from a symptom survey standpoint, starts to become a little bit easier when you understand the difference between G and the B complex. It will help you make a better decision about which product to give, whether that be Cardio Plus or Vasculin. So if you have to and you don't know, you can always go back to the foundational portion of the symptom survey and see if there is one side of that that is more predominant. If it tends to be on the B side, then I would give Vasculin. If it tends to be on the G side, I would give Cardio Plus. So let's break into the symptoms. Before we break into the symptom survey, let's look at Cardio Plus from the product bulletin standpoint. So Cardio Plus says, while cardiac indications are looked upon as being most common indication, the extent of use should not be restricted to cardiac involvements as the entire neuromuscular structure is concerned. So what he's saying there is, let's not look at this as a cardiovascular problem necessarily, or a cardiovascular product, but a product that's going to improve muscular function, which is one of the reasons why they created the product MyoPlus and Myotrophin. So MyoPlus is exactly the same as CardioPlus, exactly, and Myotrophin is exactly the same as Cardiotrophin, because some people get hung up on this idea that they have a heart problem. So for instance, I may be working with a top-end athlete, and I need to improve their ejection fraction because I want them to be more efficient and get more work out of their heart. So I can give him either Cardio Plus or Myo Plus, it's the same thing, but for that person, he may have a hang up that he doesn't have a heart problem. He doesn't need to take a heart product when I may be giving that product to him not because he has a problem, but because I want to improve his capacity. I want to nourish that system so that it optimizes his function. So know that that is the same for um, the cardiotrophin as well. It's called myotrophin. So we can use this as not only a cardiac support but a muscular support. And I often do in patients that are more athletically inclined and trying to improve their times, particularly in endurance sports. So it goes on further to say, we can use Cardio Plus wherever we find muscular problems, as it potentiates the nutrition to the muscle cell, or in this case, it potentiates the nutrition to the cardiac cell. So anytime we improve muscular efficiency, we're also going to be improving blood sugar capacity. So we should have already addressed that because we want to make sure we're looking at those top 3 areas of blood sugar and digestive and liver biliary first. But assuming those have been addressed and we're still dealing with a blood sugar issue and seeing some cardiovascular issues as well, we can influence it by improving muscular function. If we look at Cardio Plus from the clinical reference guide, you'll see that it includes the combination that we're already aware of, G, E2, the PMG, and C. And it states that this is a specific cardiac support because it supports nerves and muscles and the overall cardiovascular maintenance. And it goes on to say that it's a great natural source of coenzyme Q10. Now, coenzyme Q10 is something that we don't talk about a lot in whole food nutrition, but it is a very popular topic outside of that because it has such an important role in improving the efficiency of the heart. And of course, the way that it does that is by improving the efficiency of production of ATP. So coenzyme Q10 has never been on the label of Cardio Plus or Vascular, but it is in there. So know that we're supporting that ATP production. So when we're taking that pyruvate into the mitochondria and through the different components of the Krebs cycle and the electron transport chain, one of the coenzymes that does the job of transporting that is coenzyme Q10. So you can see where a deficiency of coenzyme Q10 would stop the entire production line of creating fuel or energy. Now if we look at Vascular, of course we see again that this is for the person who's needing more support, more zest, more life. They've got the berry sort of symptoms of I can't. They've got congestive heart failure, shortness of breath. Their blood pressure will probably be a little bit low, but it can be both. So we think of chronic fatigue, we think of muscular weakness, and also we think of cardiac fragility. So remember, we're trying to improve oxygen delivery and strength of the heart. So I think it's likely that many people not knowing the difference between Cardio Plus and Vascular tend to make errors where they are giving Cardio Plus when they should be giving Vascular. So we see that obviously Vascular, like Cardio Plus, supplies the vitamin C complex, which promotes tissue repair, particularly connective tissue, and supplies specific heart tissue extract beneficial to muscle. So that's the cardiotrophin. So in the clinical reference guide on Vascular, again, we see that it's the B, E, C, and protomorphogen. It's indicated for lower blood pressure and people with skipped heart rhythms or any sort of heart and nerve conductivity problem. And John Courtney sort of summed up the whole BG Cardio Plus Vascular right here where he says Vasculen is a cardiovascular support product for the patient with low blood pressure, auricular flutter, fibrillations, bundle branch blocks, etc. It is a multiple product containing cardiotrophin C, E, and B. The cardiotrophin helps rebuild the heart tissue. The E strengthens the muscle. The B improves the nerve conductivity. In a deficiency of the B4 factor, which is found in cataplex B, the nerves don't function properly, causing those problems such as bundle branch blocks and arrhythmias. Cardio Plus, you remember, is for the cardiovascular patient with high blood pressure, the coronary type patient. Cardio Plus contains G, which is a vasodilator to relax the patient. Like Vasculen, Cardio Plus also contains the protomorphogen C and E, so Vasculen and Cardio Plus are useful for patient with opposite needs. I don't know that I would go so far as to say opposite needs, but definitely differing needs. So let's bring it back to the patient. Our patient is coming to us with a presentation, perhaps some subjective complaints that aren't on the symptom survey. So they may be having things like pain in their left upper extremity, their arm, their shoulder, their jaw. They may be complaining of angina. They may be turning blue. Their lips may be a little blue. They may be fainting. They may be getting pain in their legs on exertion. And again, some of these are also going to be found on the symptom survey. But just remember how heart patients present. Typically cold hands and feet. They tend to have a lot of fatigue. They may be complaining of tingling in the feet or hands. And again, that berry sort of presentation, that lack of energy, that fatigue, that's not allowing them to complete the tasks that they need to in their life. Now, the objective information are the things that I'm looking for. In addition, once I see that I've got a cardiac tendency, is I'm checking obviously their blood pressure. Do they have a hypertension or a hypotension? Tachycardia to me is a blood pressure over 100, or a pulse over 100, whereas a bradycardia is a pulse under 60. So I'm looking at things like that in addition to their oxygen. So I have a little pulse oximeter that tells me their pulse and their O2 saturation. So if that oxygen saturation is under 94, it's a little concerning. Of course, the lower under 94, the more problematic. I look at their fingernails. If they're missing the luna on their fingernails, the little white semicircular kind of moon-shaped spaces at the base of their nails, that's another sign that circulation is poor. Of course, listening to their heart. Do I hear any whooshes or bruits or normal clicks? And I make note over what area of the heart I'm listening to so that I can have a better idea of maybe what side or what portion of the heart is having the most difficulty. One of the things that I look for as a chiropractor is this tenderness in the left thenar pad. Um, that's not gold, but it certainly gives me some ideas that things are going on in the heart that are reflexing in the body that may not have gone full blown like the typical heart attack patient who's having chest pain or shoulder pain. Of course, I'm also looking at subluxations or joint fixation in the upper thoracic spine, so T1 and T2. I often look at the patient's tongue. I look for a red tip of the tongue. The other thing I look for is an earlobe crease. So this little crease right here in the earlobe is actually fairly prognosticating accurate for determining risk of heart disease in patients that are under 40. After the age of 40, just with normal wrinkling and aging, many people get that crease in their ear. But for those that are under the age of 40 and you're seeing that predominant crease, that's something to consider is how bad that crease is. The other thing too, I think we covered everything on that page. Yeah. So the other objective information that we're looking at is labs. And while I don't specifically go after labs on cardiovascular patients, there's certainly things that I do look at if they have them. So we've already talked about blood pressure and O2 saturation. Um, cardiac output and ejection fraction. These are not things that I measure, but these are things that if this is a true cardiac patient who's been to the cardiologist or has had a recent heart attack, these may be things that are being measured, and it's nice to keep an eye on. So I've actually worked with a few cardiologists post heart attack patients, and they've seen the improvements that the patients have made with regards to things like their cardiac output or their ejection fraction as a result of doing things that work on improving the strength of the heart. So those things like cataplex B, vascular, coenzyme Q10, things of that nature. So I'm looking, particularly from a preventative standpoint, I'm looking at things, inflammatory markers like C-reactive protein and homocysteine, obviously markers that show that there's an active heart attack happening, things like CPK and troponin. Occasionally, it's important to think about, are they clotting? What's their clotting time? And the thing that's probably the most common that I test is the lipid panel. So I do an advanced lipid panel that gives me an idea of their genetic risk. So lipoprotein A is a great genetic risk factor, as well as the presence of those smaller, more dense lipoprotein particles. So no longer am I considering just LDL as the bad cholesterol and HDL the good cholesterol. I think when the LDL pattern is large and buoyant, it's a very safe pattern, but when it's small and dense, and even HDL proteins, when they're small and dense, are going to be more deleterious to the vasculature and more problematic. So other things to consider from objective means is EKGs and a 24-hour heart monitor, or what's called a Holter monitor. Again, not a thing that I do in my office, but certainly something that I pay attention to or have occasionally referred for when I have a patient who is suffering with ventricular fibrillations, or I hear their heartbeat doing abnormal things. Before I jump into a case where the patient could die, I want to make sure that they're safe and stable. But when I hear those, what am I doing? I'm sending them out the door with either Cardio Plus or Vascular. Of course, if I had a machine that could listen to the heart and monitor on paper, that would be excellent. That's what's called the endocardiogram. And for information on the endocardiogram, I'd have to refer you to Joseph, because that's not my specialty. But the endocardiogram is something that may be coming back into more use, as it sounds like we have an opportunity for new endocardiograms to be on the market. So more on that later. And of course, hemoglobin A1C, I'm making sure everybody's blood sugar is doing as well as possible, because that's where the predominant problem in our society is we're becoming overweight and obese from eating too many carbohydrates. So for the simple office, and I consider myself a simple office, I'm really looking at hip to waist ratio and abdominal obesity. So it's important that we're focusing on men having a waist less than 40 inches and women having a waist of less than 35. When we see that enlarged waist or hip-waist ratio, we know that there's more inflammatory markers that lead to vascular disease. And the problem is that about 50% of adults are abdominally obese, which is leading us to metabolic syndrome, which is sort of what has been termed pre-diabetes. And metabolic syndrome is a diagnosis that's given when a person meets 3 of the following criteria. So if they have that increase in abdominal obesity, if their fasting glucose is over 110, if their blood pressure is over 30, over 80, or if their triglycerides are over 150. And if their HDLs are too low, if they're below 40 for men and below 50 for women, this is and they meet 3 of those 5, or 4 or 5 of those 5. This is a person who is clearly going to become diabetic, and as a result is going to have a much higher cardiovascular risk. So now that we've talked and examined our patient, let's look at their symptom survey. And we're focusing on some of the cardiac areas. Questions 58, 59, 60, and 66 are all about cardiac stress. And so cardiac stress means I'm giving them either cardio plus or Vasculen. So now the decision just has to be made. Is this a person that has high blood pressure or more need for relaxation? Are they having that kind of problem, anxiety and tension? We go cardio plus. If they're more of a low blood pressure person, or they need more energy, if they're more of that I can't, I would do Vasculen. So questions 57, 63, 62, 61, 65 tend to be more about cardiac stress in the adrenal glands. So again, the same rule applies, cardio plus for the people that need more relaxation and blood pressure decreasing, and Vasculen for people that need more fuel, more energy, more zest, or have lower blood pressure. And because a lot of this has to do with adrenal function, we're looking at Drenamin. So here's something to consider. Let's look at Drenamin. Drenamin is another compounded product that contains, guess what, cataplex C, which we just talked about, and it contains cataplex G, which is what we've been talking about, and then a little bit of the protomorphogen, which helps remove barriers to healing to the adrenal glands. So you can see an excellent situation where you could give them Drenamin, which contains the cataplex G, and you could give them Vasculen, which has the cataplex B, and be, in essence, was it killing two birds with one stone? So if we look further on Drenamin, of course, we see from a cardiovascular standpoint, it tends to be a situation where we're seeing vasomotor disturbances or adrenal cytotic reactions. So this is the person who has orthostatic hypotension, the person who's getting head rushes when they sit up or stand up after laying down or sitting down. And this is where you can do the blood pressure laying down and the blood pressure standing up. And if that drops, this is obviously a situation where they need more ability of the heart and vasculature to respond more quickly. And Drenamin is really important with that. Again, as you read through the product bulletin, you see that Drenamin is basically built on blood pressure aberrations and things where people are neurologically fatigued, which is neurasthenia. Question number 64 of the symptom survey deals with cardiac stress, particularly around kidney, with the idea that the kidney being a filter is sort of dependent on the flow of blood. And if the heart is not working very well, we better improve the pump through the filter first. So that's where we make the decision, cardio plus or Vasculen, depending on the profile of the patient, and then things that are going to be helping or supporting renal function. So we don't have time to talk about renal function today, but in general, you could go to the product bulletin and look at these 4 products and make some educated decisions on what would be best. So I tend to be an Arginex user as my go-to kidney helper router for anything where I need to help the kidneys become more efficient at filtering and getting rid of excess fluid on the body or swelling. So with swollen ankles, which is question 64, it's also question 166, and I guess, and it's also in the foundational group as well. So that's actually represented 3 areas in the symptom survey. So again, it's all about getting the heart up to function, which is either cardio plus or Vasculen. So another reason that the cardiac system or the vascular system can be stressed is because we're not actually delivering oxygen, and the pump can be just fine, and the vascular can be just fine, but we're actually not oxygenating our blood because we don't have enough of it, or it's not very good. So that's anemia. So if they're answering questions like tendency to anemia, or sometimes ringing in the ears can be a sign of anemia, we start looking at their digestive function and their ability to assimilate iron. So Zypan obviously being something we talked about in the digestive function portion of the building a comprehensive series, and that was session number 2. And then, of course, Ferrofood, which is the kind of the gold standard iron product. So I just never fail with Ferrofood, whether it's the anemia of somebody that's pregnant or any number of other factors or not consuming enough iron. Ferrofood really works like a charm every time. Chlorophyll complex is another excellent blood builder. And while I'm here and we're not too far behind, I'd also mention the Medior product Femax. So if, for instance, you had a vegetarian patient who was very vehement against any taking any animal product, because I would normally otherwise put everybody on Parafood because it always works, it never fails. Um, I would do chlorophyll complex or the Mediherb product called Femax. And I think the last question from the cardiac portion of the symptom survey is hands and feet go to sleep easily. So this is more of a question of circulation. And the final sort of triad product is called Circuplex. So Circuplex is another product like uh, Cardio or Vascular in that it's a combination product that puts the B vitamins niacin and B6 along with some phosphate and ribonucleic acid into one product. And the idea behind this product is to improve uh, the flow of blood through the blood vessel. So for the person who has uh, atherosclerosis and hardening of the arteries, they tend to have hands and feet that are cold or they go to sleep easily. So that would be a situation where I do Circuplex. Recently, I had a patient when I took her blood pressure. Um, Her blood pressure, as I was listening to it in the stethoscope, I got my first number and it was whatever, 125, 126, and I'm listening to the pulse in my stethoscope, and I watched the pin on my blood pressure cuff go all the way to 0. So her diastolic pressure was 0. So that's impossible. That would mean she was dead. But I heard what I heard. So what was the deal? So when that diastolic pressure is going, well low, and this is on an elderly patient, what that suggests to me is the integrity of her vasculature is is lost. She no longer has a flexibility or a pliability in her vasculature, and so I'm reading the pressure inside that system as 0. So this is a person with atherosclerosis, which would be the perfect patient for investigating Circuplex is something to help improve her circulation and hopefully help to remove some of that plaquing, because if it's in the artery in her forearm that I'm listening to, it's probably in the arteries of her heart as well. So there's a host of other products to consider with regards to cardiovascular function. We didn't even talk anything about the omega-3s and their importance, and obviously minerals and their importance for relaxing nerve flow, which we'll get into a little bit more next time when we talk about sympathetic parasympathetic balance. All the different C vitamin potentials like Caplex ACP, Cyruta Plus, niacin, and its B vitamin component, which I don't think about as often because Cataplex B or Cataplex G does contain those as well. Um, but if I could leave you with one product to consider or learn more about, it would be Hawthorne. Hawthorne is a Mediherb product, and it does a very fantastic job of improving things like stroke volume, ejection fraction, cardiac output. It tends to lower blood pressure or normalize blood pressure. So even on the low blood pressure person, it'll raise it, and on the high blood pressure person, it'll lower it. So if you had a more serious cardiac involved patient, in addition to your Cardio Plus or your additional Cataplex B or G or Vascular, whatever the case may be, the addition of hawthorn can be a very powerful and potent helper in supporting that tissue or supporting that patient. So again, once I've completed or worked through their blood sugar issues and their liver biliary system and their digestive issues, and heart is the primary, or this is a person that's recovering from heart surgery, this is where I would pull in the extra firepower of a product like hawthorn. So that kind of wraps us up for those two sections of the symptom survey today. Uh, on the notes for the presentation, I've got some links for some upcoming opportunities, educational opportunities. This is the SP West calendar of events, which I think you can get to by just going to standardprocesswest.com, and of course a link to some of the upcoming seminars, and a reminder that we have a monthly teleconference, the Montana Nutrition Collaboration. That's the second Monday of the month. Mentoring the Mentors is one of my mentors, Dr. Stuart White, and he presents every other month on the fourth Thursday from 6 to 7 Mountain Time. So I'd like to thank everybody for joining us for this session. Next session will be session 7, and we'll be looking at sympathetic parasympathetic balance. And I'd like to thank everybody for joining us. And if you have any questions, you can go ahead and put them in the chat menu. It doesn't look like we have any chat questions, so I'm going to stop the recording.